At this time, I'd like to yield 5 minutes to Mr. Hillscamp from Kansas.
Thank you, Mr. Chairman. I appreciate the opportunity to speak today about one portion of the budget, but I will want to note that yesterday when the Budget Committee, at least our side, unveiled to the public our vision for the country, one theme was evident. Washington has to change the way it does business. It has to stop thinking that all problems can be fixed with more money, more federal intervention, or a combination of the two. One item I am particularly supportive in the Republican budget is the change in the way states receive Medicaid funding. If left untouched, the cost of Medicaid will soar out of control, and the program will continue to overtake a large share of the budget with little regard for efficiency, effectiveness, and innovation. Medicaid spending is spinning out of control, and it's bankrupting not only the federal government, but many of the states. Some say that the way to make sure Medicaid continues to exist is to just throw more money at the problem. From my experiences in dealing with Medicaid in Kansas, I know that is not the solution. When serving in the Kansas Senate in 2003, I had the privilege of co-chairing a Medicaid task force. We looked at ways the states could improve Medicaid services as well as spend money more effectively. But one of the challenges we continually encountered was that the state of Kansas and many other states are limited in what we could do with the money from the federal government, but also the state share. Specifically, we were looking for a way to keep frail and elderly persons on Medicaid from having to go into nursing homes, a worthy goal. We wanted to find a way to provide health savings accounts to beneficiaries so they could stay in their homes, but still receive the medical care they needed. And we did construct a plan that improved care and saved money. Amazingly as well, even our Democratic governor, Kathleen Sebelius at the time, now Secretary of HHS, even signed on to this plan. But our request for a waiver was rejected here in Washington. Indeed, to date, 451 waivers have been granted in the Medicaid program, but there are perhaps untold thousands of waivers just like that in Kansas that were rejected. We tried to find out actually how many have been denied over the years, but CMS didn't want to tell us, probably for obvious reasons, and our rejection was one of them. It's disappointing that so much authority can be wrapped up in the hands of some federal bureaucrat at the Centers for Medicare and Medicaid Services, who may have never been to Kansas or any of our states, or even to a nursing home. It is disheartening that Kansas and other states have to bow to Washington when trying to do good things for the people of our states. Too much red tape kept us from improving Medicaid in Kansas, and 49 other states are also locked into the same dictums from Washington when it comes to this program. Instead of having the essential flexibility we need to administer the program in our state's best and unique interest. We all know that governors from across the entire nation on a bipartisan basis have expressed their desires to have more flexibility with Medicaid funding, and this budget offers exactly that. In converting federal spending on Medicaid to block grants, governors, state legislators, and other state-level administrators will have the ability to direct funds in a manner that works best for their states and their citizens, not for the Washington status quo. Finally, this budget assumes a complete repeal and defunding of the President's health care plan, and that is a good thing. Obamacare, also left untouched, places an even larger burden on states. It forces states to expand Medicaid eligibility, but leaves it up to them how they will find money to pay for it. This was a bad policy to begin with, and proposing that we just spend more on Medicaid is simply not the solution. There are those who will oppose Medicaid reform and will try to label these changes as uncaring about low-income Americans or those who find themselves on hard times, but such a judgment couldn't be further from the truth. By lifting the heavy hand on Washington on these programs, we actually make them more effective and more efficient for the states, but better for the recipients who truly need assistance. Doing nothing about Medicaid is no longer an option. Real change is desperately needed, and this path to prosperity is a real solution to the changes we need. Chairman, I yield back my time.
Thank you. At this time, I'd like to